From NBC News, this is Today's Take with Al Roker, Natalie Morales, and Willie Geist, live from Studio 1A in Rockefeller Plaza.
Now to our special series, Hope to It, and a woman who conquered breast cancer and now is helping others like her.
Dora Arias uses her own experience and her Spanish-speaking skills to help underserved women navigate their diagnosis.
And we met up with her at the Carol G. Simon Cancer Center in Morristown, New Jersey.
My name is Dora Arias, and I'm a 10-year breast cancer survivor. I was born in Colombia and moved to the States when I was 7 years old. I'm married and I have 2 grown daughters. I was diagnosed with breast cancer 10 years ago, and it really caught me by surprise. I started with my annual mammograms at the age of 37, based on the recommendation from my gynecologist. The first time my baseline was clear. The following year, when I was due for my second annual, my husband pushed me, and that's when I was diagnosed. I was overwhelmed. Although I spoke the language, and I had medical insurance, and I had great support structures, it was very difficult for me. I always thought, what do other women do when they don't speak the language? What do other women do when they don't have medical insurance? So that's why I established Curemonos. It means healing together. Our mission is to help medically underserved women affected by breast cancer, and part of our mission is to provide education, support, and advocacy. Those 3 components are key. What Curemonos does, or Healing Together does, is we take women in the community that do not have insurance, that need a free mammogram. We take them into the hospitals that provide those programs for free. I don't have an office. My office is really the hospital settings or coffee shops in the community. Okay, she told me that they told her that. And if they don't speak English, typically what I do is I accompany them to the doctor's appointments and I prepare them for that visit. I tell them, please do a list of questions in Spanish. Let me know what you want to know, what your fears are, what your symptoms are, and what you want to know about the process. Okay. She said that the last time she was here,
she can kind of really get under what the issue is and really ask follow-up questions and then really get to, you know what the real problem is here. So it's huge for all of us, especially the patient's safety.
she still sees it the same.
She not only serves to interpret what they're saying accurately, but she teaches me about the cultural implications that may impact a woman's ability to receive her treatment or her care.
Uno nunca piensa que va a estar enfermo, nunca. Y la enfermedad siempre llega cuando uno menos lo espera. Y que se queda uno como tan desubicado que uno dice, ¿para dónde cojo? Y cuando me llega ella, como que uno ve una luz. Dice, gracias, Dios mío, gracias.
I love what I do. It gives meaning to my breast cancer diagnosis. I cannot take away all of the pain and fear, but just to make a little bit of a difference, to me that's huge.
And while Curemonos started out as an organization for Latina women, Dora has now expanded to help all underserved women. What a great woman,
Really?
and really such a necessity.
You wonder what all those women were doing without her.
Yeah.
So glad she stepped in.
That's terrific.
Unfortunately, a lot of hospitals don't have translators on staff.
Yeah, that should be changed, that's for sure. Well, coming up next.